my name is Eve, and I am a student at the University of Pittsburgh School of Nursing. Today I'm going to be showing you how to go through your Foley competency exam. This is to help you prepare for your exam, but it's also to help you in real life when inserting a Foley catheter on your patient. You've practiced at home with a bottle, and there are many mannequins in the skills lab that you can practice on, but this particular mannequin has a foreskin, and we would like to show you how to catheterize a patient with a foreskin. The first thing you'll need to do is confirm the physician's order and assess the catheter size needed for your patient. Of course, you're going to identify your patient by checking the armband, and you're also going to check for any known allergies. You will also need to explain the procedure to the patient and always maintain patient privacy. We are ready to begin with our table in the correct place, our catheter kit ready, our clean gloves, and our trash can, all in the appropriate places. You may also want to have an extra pair of sterile gloves in your pocket. Now I've already washed my hands and put on non-sterile gloves, and now I'm ready to begin opening the package. Now I'm going to pick up the sterile drape. It's okay to use your non-sterile gloves when doing this, but just be careful that you don't contaminate anything sterile underneath of the drape. Now I'm going to place it beneath the patient. You'll want to place the shiny side down when you place it. Okay, now you're going to want to take off your non-sterile gloves, and you're going to want to put on your sterile gloves. But make sure when you pick up your gloves that you don't contaminate your sterile field beneath it, and that you bring your sterile gloves over to the side so that the gloves are not touching your sterile field. And now you're sterile, so you want to make sure you keep your hands above your waist and closed if possible. You can get rid of your garbage by dropping it on the floor, or hopefully you have a trash can right next to you. You can pick up the diamond drape and throw it into the garbage because you're not going to need it. First thing you're going to want to do is get your cleaning supplies ready. In the kit you have a package of betadine and some cotton balls. You can pick up the forceps and put them over to the side. Open the betadine packet and pour it directly over the cotton balls. Like so. The next thing you want to do is get your catheter ready. So you're going to carefully pick up the top tray. You can pick it up like this and bring it over to the side. Just be careful when you set it down. The next thing you want to do is remove the plastic wrapper that's enclosing the catheter, but you want to be certain that it doesn't flop around when you take it off, so be careful to encase it in your hand and slowly remove the wrapper. Now you're going to add your lubricant to the tip of the catheter. Your lubricant is in the top tray. If you set your catheter down, just make sure it doesn't flop around and that it's nicely coiled in there. And pick up the top of the catheter and liberally put the lubricant on top. You can set the lubricated catheter tip back in the bin. And you're done with the lubricant. So, you may see a different type of Foley kit that contains lubricant in the syringe. You may want to take the syringe and insert the lubricant directly into the male meatus. That is perfectly acceptable. You'll want to check the evidence-based folder as to whether or not you're going to inflate the balloon prior to insertion or not. Now we're ready to bring the catheter over to the patient. But what do we do? How do we get it from here to there? Can we put this back on top of this? No. We can no longer put this on top of this because we set this on a non-sterile surface. Now we're ready to clean the patient. With your non-dominant hand, you're going to firmly grasp the patient's shaft. With your sterile hand, you're going to grab the forceps and a cotton ball with a betadine. With your sterile hand, take the cotton ball and wipe in a circular motion beginning at the tip of the penis. And you can discard this to the side. I'm going to repeat. Be careful that you don't contaminate your sterile hand by touching any part of the patient. I lost that one. Okay. You're now ready to get your catheter. So with your sterile hand still, you can come over, pick up the box, and bring it closer to the patient. And now we're ready to begin the catheter insertion. I'm going to hold your hands close to the tip so it gives you a little bit more control while putting it in the patient. But you want to be careful that your sterile hands don't touch the tip of the patient while you're inserting it. You can see that we have a urine return already, but in a male patient, we're going to go all the way to the tip of the Y site. Now that the catheter is in, you're going to take your syringe with the fluid. With your non-sterile hand, bring your hand down lower so you can grab onto it so it doesn't come back out on you. It's not working. So now that the catheter is in, you can take your non-sterile hand and bring it down and hold it at the tip so that the catheter doesn't slide back out from the patient. You're going to take your syringe of fluid and remove the cap and insert it here in the port and insert the fluid. You're going to twist off and gently pull back. And the catheter is in. Now remember, if you had checked the balloon for patency earlier, your syringe would have already been attached to your catheter. And remember, before you do anything else, to replace the foreskin. And a real patient, it's a lot easier. You're going to take the bag, make sure you place it below waist level, down here on the side of the bed. It's a little hook, and it just goes there. And then you're going to always make sure that you attach securely your catheter to the patient's leg with a stat lock or whatever your hospital uses. And make sure when you're done, you document the characteristics of the urine, how well your patient tolerated the Foley insertion, and the size of the Foley you inserted. Now it's time to remove the Foley. There's a couple things you want to keep in mind before you take the Foley out. You want to make sure that there's a doctor's order for the Foley removal. You want to check the size of the balloon so you know how much fluid to take out. You want to check if you need a urine culture before you remove it. And lastly, and most importantly, the patient identification. Attach the syringe to the port and let it passively fill back. So you attach the syringe to the port, allow the fluid to fill back into the syringe. We removed 10 milliliters of fluid from a 10 milliliter balloon. Take the fluid, squirt it out, and reattach the syringe to make sure that there's no residual fluid. I can't pull back any other fluid. Now before we remove the Foley from the patient, we want to coach the patient that it may feel a little abnormal. We're not supposed to say that. It's a good idea to get a towel and place it underneath the Foley so that there are no spills when you remove the Foley. Remember to coach your patient that it's going to feel a little odd, so take a deep breath and blow it out as I pull it out. Ready? Take a deep breath. 1, 2, 3. And it's out. After you remove the Foley, it's important to ask the patient to let you know the next time they need to pass their water.